If your doctor prescribed this medication for you, your erection is in danger. And the worst part, 8 out of 10 men over 50 take at least one of these drugs without knowing the damage they're causing to their sex life. I'm about to reveal the 5 most common medications that destroy testosterone, kill libido, and cause erectile dysfunction, and you probably have at least one of them in your cabinet right now. Stay until the end, because I'll show you the safe alternatives your doctor should have prescribed. Let's go. Hello, I'm Dr. Roberto Andre, and today I'm discussing something the pharmaceutical industry doesn't want you to know. Many of the most prescribed medications in Brazil are destroying the sex lives of millions of men. I see men every day in my office complaining about weak erections, zero libido, extreme fatigue. And when I ask what medications are you taking, the answer almost always reveals the problem. They're taking drugs that block testosterone as a side effect. And the worst part, many doctors don't warn about these effects, whether from lack of time, lack of knowledge, or because the industry doesn't clearly disclose it. The result? Sexually healthy men start taking an innocent medication and within 3 months can no longer get an erection. But safer alternatives exist for most of these cases, and I'm going to reveal everything now. First, subscribe to the channel, turn on the bell, and leave your like, because this video could save your marriage. Let's get to the 5 dangerous medications. The first performance-killing medication is finasteride, brand names Propecia Prescar. This drug is prescribed for 2 problems: hair loss and enlarged prostate. And yes, it works. The problem is how it works. Finasteride blocks the enzyme 5-alpha reductase, which converts testosterone into DHT. Excess DHT causes hair loss and prostate growth. So far, so good. But here's the problem. DHT is also essential for male libido, strong erections, and sexual function. When you completely block DHT, your body goes into sexual collapse. Studies show that up to 15% of men taking finasteride develop erectile dysfunction, loss of libido, and even depression. And the worst part, in some cases, these effects are permanent, even after stopping the medication. This is called post-finasteride syndrome. I've treated dozens of men who traded hair for erection. Literally, they stopped losing hair, but lost the ability to have sex. Is it worth it? SAF. Alternatives. For enlarged prostate, consider saw palmetto natural, dietary changes, and specific exercises. For hair loss, topical minoxidil doesn't affect testosterone, or accept baldness with dignity. Baldness is masculine, impotence isn't. The second destroyer medication is practically every antidepressant in the SSRI class: fluoxetine, sertraline, paroxetine, escitalopram, brand names Prozac, Zoloft, Paxil, Exapro. These medications are prescribed for depression and anxiety. Help many people with mental health, but the price you pay in your sex life is brutal. SSRIs increase serotonin in the brain. Excess serotonin blocks dopamine, and dopamine is the neurotransmitter of sexual desire, motivation, reward. Without sufficient dopamine, you simply don't feel like having sex. Studies show that between 40% to 70% of men taking SSRIs develop sexual dysfunction, difficulty with erection, delayed or impossible ejaculation, weak or absent orgasm, and zero libido. And there's another problem. SSRIs reduce testosterone directly. A 2018 study showed that men on long-term SSRI use had testosterone 20% lower than men without medication. Safe alternatives. For mild to moderate depression, consider bupropion, Wellbutrin, which doesn't affect sexual function and even increases libido. Or cognitive behavioral therapy, aerobic exercise, vitamin D, and OME, GA3, supplementation, always with medical supervision. The third killer medication is statins for cholesterol, Symvist, brand names Lipitor, Crestor, Zocor. But doctor, isn't high cholesterol dangerous? Yes, very high cholesterol can be. But the problem is that statins are over prescribed to people who don't even need them, and they have a devastating side effect. They destroy testosterone. Why? Because testosterone is made from cholesterol. It's the raw material. When you take a statin and drastically reduce cholesterol, your body loses the ability to produce sufficient testosterone. Studies show that men using statins have testosterone up to 30% lower, and the symptoms: chronic fatigue, loss of libido, difficulty with erection, abdominal fat gain, loss of muscle mass. And there's another side effect. Statins cause muscle pain and weakness in up to 20% of users because they block TOC10, an enzyme essential for cellular energy. Less energy equals less sexual desire. Safe alternatives. For moderately high cholesterol, dietary changes work better than medications. Eliminate sugar and refined carbohydrates, increase healthy fats, consume soluble fiber, practice exercise. If you really need medication, talk to your doctor about lower doses or other options. And go ahead and leave your like on the video. The fourth dangerous medication is beta blockers for high blood pressure. Propranolol, etoprolol, brand names, Inderal, Adenol, Celazoc. Beta blockers control high blood pressure and protect the heart. They're useful in many cases. Serious problem. They reduce peripheral blood flow, including to the penis. Erection depends on blood flow. Beta blockers reduce that flow. Result? Difficulty with erection, weak erection, or total inability to achieve erection. Studies show that between 20% to 30% of men using beta blockers develop erectile dysfunction. And it's not psychological, it's mechanical. Less blood equals less erection. And there's another problem. Beta blockers reduce energy and overall disposition, cause fatigue, and some studies suggest they may lower testosterone indirectly by reducing physical activity. Safe alternatives for high blood pressure. There are other drug classes that don't affect erection. ACE inhibitors, enalapril, captopril, or calcium channel blockers, amlodipine, or lifestyle changes, weight loss, sodium reduction, aerobic exercise, stress management. Always with medical supervision. It's the fifth and surprise. Omeprazole. Brand names. Prilosec, Losec. This is the heartburn and reflux medication that everyone takes without prescription, without supervision, for years. But Dr. Omeprazole is just for the stomach. Yes, but it has effects on the entire body. Omeprazole reduces gastric acid production. Without sufficient acid, your body doesn't properly absorb vitamin B12, magnesium, zinc, iron. And guess what happens when you become deficient in zinc and magnesium? Testosterone plummets. Zinc is crucial for male hormone production. Without zinc, there's no testosterone. Recent studies show that men on long-term omeprazole use more than 6 months have double the risk of testosterone deficiency. And the symptoms appear gradually. Fatigue, loss of libido, difficulty with erection, depression. And it gets worse. Chronic omeprazole use increases risk of osteoporosis, weak bones, and dementia. It's a medication that should be used for at most 2 to 4 weeks, while Brazilians take it for years. Safe alternatives. Treat the cause of reflux. Lose weight. Avoid acidic and fatty foods. Don't lie down right after eating. Elevate the head of your bed. If you need something, use natural antacids, like occasional bicarbonate, or switch to ranitidine, under medical guidance. And never take omeprazole for more than 8 weeks without supervision. And if you're taking any of these medications now, calm down. Don't stop on your own. Stopping medications abruptly can be dangerous. Step 1. Talk to your doctor. Show this video if necessary. Ask about alternatives that don't affect sexual function. STEP2. If there's no side alternative and you really need the medication, consider adding supplements that protect testosterone, zinc, magnesium, vitamin D3, omega-3. Step 3. Optimize your lifestyle. Strength training, diet rich in healthy fats, quality sleep, stress management. This can partially compensate for the negative effects. Step 4. Monitor your hormone levels. Request total and free testosterone tests every 6 months. If it's very low, hormone replacement therapies exist. The important thing is to KNOW what you're putting in your body and demand that your doctor consider your sex life. Sexual health is overall health. Are you taking any of these 5 medications? If so, schedule an appointment with your doctor today and discuss alternatives. Your sex life doesn't need to be sacrificed for your overall health. It's possible to have both. And attention, in the next video, I'm going to reveal the 3 tests that every man over 50 should take, but that 90% of doctors don't order. These tests can save your life and your sex life. Don't miss it. If you liked this video, leave your like, subscribe to the channel, turn on the bell, and share with that friend who's taking medications without knowing the side effects. You might save his sex life. And tell me in the comments, have you or someone you know had sexual problems because of medications? Come there. Let's create a community of informed men. A hug and see you in the next video.